What is the best treatment for a cystocele? Well, first, you need to know what a cystocele is and how it develops. In this video, we'll discuss that, just how your bladder is involved, and 3 other important queries around cystocele. What is the difference between a cystocele and a prolapse? How serious is a cystocele? Can you feel a cystocele with your fingers? Let's get started. According to the Collins Dictionary, the word cystocele is first recorded between 1805 and 1815. Developing a cystocele is quite common, and according to data, it affects nearly 50% of women. It's also one of the more embarrassing conditions to reveal or discuss with your doctor. So I hope watching this video makes it easier for you to have a factual conversation with your doctor to help solve this problem. It's a condition where your bladder, or a part of it, sags into your vagina, creating a bulge or a lump that you really can't ignore. Normally, the vagina is a hollow tube that connects the womb to the vulva. The womb, as well as other organs in the pelvis, that is the bladder sitting in front and the rectum and anus sitting behind, are held in place in the pelvis by strong ligaments and muscles. Those muscles, ligaments and tissues are known as the pelvic floor muscles. And when they get weaker, those organs, the womb, the bladder, the rectum, or parts of them sag, resulting in something called a prolapse. And it's that organ part that's prolapsed which appears as a bulge in the vagina or the vulva, and sometimes it can be pushed back into the vaginal canal, similar to the way that people can push back a hernia, unless it gets too large. So this brings us nicely to answering the first question. What is the difference between a cystocele and a prolapse? A cystocele is a type of prolapse. In the case of the cystocele, part of the bladder drops into the vaginal canal to one degree or another. In addition, or as an alternative to calling it a cystocele, people also refer to this condition as a dropped or fallen bladder, or you might hear herniated or prolapsed bladder. A cystocele is more likely to develop in those conditions where the pelvic floor and ligaments are weaker. These conditions include pregnancy, being overweight, having your baby vaginally, going through the menopause, experiencing a chronic long-term cough, or lifting heavy weights for a period of time without giving due care and attention to protecting your pelvic floor. Well, on a scale with other serious or life-threatening gynecological conditions, the cystocele is not as high on the scale as things like womb cancer or a pelvic inflammatory disease, for example. But depending on how severe the cystocele is, it can cause quite distressing and serious medical problems. There are 3 categories or grades of a cystocele, depending on how far or the extent to which the bladder or part of the bladder drops within the vaginal canal. The most severe is grade 3. Here, the bladder sags very well beyond the opening of your vagina, and in this case will give rise to a lump that you will feel. This can lead to very serious problems such as being unable to pass urine at all. You might suffer from recurrent urinary tract infections. Grade 2 cystocele is moderate because the bladder sags to just around the opening or slightly after the opening of the vagina. And finally, grade 1 cystocele is mild as the bladder sags only a short way into the vagina. And even though we call this mild, this type of cystocele can lead to problems like leaking or wetting yourself because you lose the ability to control your bladder. In addition, a cystocele can cause pain around the vulva, but also be associated with pain or heaviness in your pelvis or lower abdomen. This pain may seem worse if you stand up or are lifting something heavy. It might also get worse throughout the day, peaking in intensity, usually last thing at night. In addition to trouble emptying your bladder, you might also experience the urge to go to the toilet frequently because you don't feel as if you've completely emptied your bladder each time you go. Sexual intercourse or using sanitary products like a tampon or menstrual cup can also be quite difficult and uncomfortable if you have a cystocele. And so with all this information, we can now easily answer the next question for this video. Well, the answer to this is it depends. From our grading that we've just described, we just saw that you probably can't feel a grade 1 or mild cystocele unless you can pass your finger very well into the vagina. But for grade 2 or certainly for grade 3, you will feel the lump or bump of that part of the vagina as it sits outside the canal or just within the entrance of the vaginal canal. So what's the best way to address this problem and get things fixed, whether it's grade 1, 2 or grade 3 cystocele? Well, again, it depends. And each person who has the condition will have to sit down and work out the best option with their doctor. There are different treatment options that depend on the grade. These options include losing or maintaining a healthy weight, using hormone replacement therapy for menopausal women, pelvic floor exercises, which I described in this video, to strengthen the pelvic floor is an option either by itself or with other treatment methods for mild or moderate cystocele. Next, having a device known as a vaginal pessary inserted within the vaginal canal. This aims to push the organ that's prolapsed back in place into the pelvis and away from the vaginal canal. And because the pessary device is left in place within the vagina, it means that the organ cannot prolapse or travel back down into the vagina. This tends to be a good option for people with moderate or quite severe prolapse, especially if they can't have surgery or pelvic floor exercises will not help. In moderate or severe cases, or just when other methods have not worked, then surgery is another treatment option. There are different surgical options that depend on your specific requirements, but most often you will probably have what is known as a type of reconstructive surgery known as the anterior colporrhaphy. This simply means that they will tighten those weak pelvic floor muscles, of course, after lifting the bladder back into the pelvis, preventing any future prolapse. In many cases, the colporrhaphy can be performed as an outpatient procedure. There's a lot more involved, of course, in preparing for this type of surgery, but it can be quite an effective option if it's thought necessary for you. Preventing a prolapse is so important. Remember we talked a bit earlier about who is more likely to develop one? Keeping a healthy weight, regular exercises including pelvic floor or Kegel exercises, avoid smoking which can lead to chronic coughs, avoid lifting heavy items, or if you're involved in heavy physical activity, protect your pelvic floor muscles during heavy physical activity. Don't try to lift heavy objects by yourself. If you find you have to lift something heavy while you're on your own, or if you're working out, use proper form. Bend your hips and your knees to squat and keep your back straight. Don't twist your torso while you're lifting, and please seek help early if you feel a lump in your vulva or vagina and you're worried it might be a cystocele. Thanks for watching. Let me know if you have any other questions. Check out this video playlist where I talk a lot more about vulval and vaginal health, and I'll see you again soon.